So here's my presentation today, just to explain. This was a mural of the Cuban flag, and there's lots of what they call propaganda of Commander Fidel Castro, and so that's speckled all over. You'll see it in the health clinics and all over in the park here, there. So I thought it would be fitting to have that there. So I went with MEDICC, which was Medical Education Cooperation with Cuba. And they're an amazing group. They're based out of Oakland, California, and they do a lot for, it was started by a journalist, this woman right here, Gail, and they do a lot in terms of collaboration, in terms of helping low-income individuals from the United States study at ELAM, which is, we'll talk about that more in the later on, but it's a medical school only for international students in Cuba, funded by the Cuban government. So MEDICC does a lot, and they actually requested us, those of us who are coming, if you could bring some gifts. So I packed my suitcase full of surgical gloves and towels and other medical supplies, and everyone, about 19 people or 15 people who came on the trip, also did the same, so we were able to contribute also, in addition to learning so much. So the theme of our trip, it was pretty amazing. It was women, health, and leadership. So MEDICC organized this beautiful trip with all women entrepreneurs and leaders and medical directors and heads of parliament and all kinds of things, for people for us to meet and inspiration for us. And the entire group was women, except for a young man, someone's son joined along. And so the women who came from the US on this trip were, the women who were presenting to us, let me start with that, were the director of a polyclinic, professors, an organic farmer, molecular immunology researchers, psychologists, activists, and students. So let me tell you a little bit about what's happening in Cuba right now as of 2017. The population is a little bit more than 11 million. It's about 20% 60 and above. Urban dwellers are a large majority, and the life expectancy is about 78 years. I won't go through all of this except to say that they have impressive numbers in terms of how many health science universities they have, how many healthcare institutions. The polyclinics, which we'll also talk about, are the backbone of their health system, and they have many of those. They have full immunization coverage. We'll also discuss that. So just to give you some more background information about women, because that was the sort of topic of our trip. They're half the population. They have a little bit better life expectancy and health behaviors. And they have pretty good education. At least mostly half have finished high school. We also talked a lot about the social landscape of women and gender as well on this trip. So 45% are in the paid labor force. And just to give you an idea, before the revolution in 1959, about 13% were part of the workforce. So it's increased quite a bit. And I've just thrown in some pictures just to show you how it is. Maternal health is one of the most incredible achievements that Cuba's health system has. Being not a high-income country, they've already achieved the Millennium Development Goals. Many, even though they expired in 2015, many countries are not there yet, but Cuba is, and they have a lot of agreements in place with women's rights, environmental rights. In 2015, Cuba became the first nation to eliminate altogether, HIV transmission from mother to child. That's a huge achievement, and we're not anywhere near that yet. Cuba is one of the safest countries to become a mother because of all of the infrastructure that they have in place for taking care of expecting mothers. And they have a great doctor to patient ratio. It's the highest in the world at 127 people per doctor. And 61% of the physicians are women. And so they have a lot of work to do, but they've made many accomplishments in terms of gender as well. So this is just another propaganda, or there's no advertisements there, if you can imagine. So these are the only kind of billboards and signs and things, and this means, you know, strength in our unity. And so our first day there, we got to hear from this professor who was teaching for over 40 years at the University of Havana. She's an amazing professor. She's a consultant on gender for several UN agencies and has done amazing work. And one of the really cool things that she did was she was able to interview different pop musicians and talk to them how they perceive machismo, which is the term of masculinity or toxic masculinity, and interview them, ask them, what do you think of this, and how can we change this in society? And they were all aware of it, but told her later on that they had to sell what they had to sell, so they couldn't change their music. So in terms of machismo culture, it's there in Cuba. If you've ever been to Latin America, that's part of the culture. And so a lot of what the women were talking about that we met, were talking about shifting the perception and the second shift. So part of that culture is that women, many of the women, about 60% of the women have professional jobs, but they're not able to come home and relax. They also have to do the cooking and cleaning, even if their partner is unemployed, because of the culture. So one of the big things was they were talking about changing that second shift. So on the second day, we were able to go to a polyclinic, and I was only there in Cuba 1 week, so I hope that this is an invitation to research more about the health system, because forgive me if I get something wrong here, but it was quite complicated, but it's very amazing. So we went to this clinic called the 19th of April, and does anyone know the significance of that date?
It must be a revolutionary date.
Yes, for them, it was the Bay of Pigs victory.
Oh.
So this is the 19th of April clinic. And I put that map there because one of the most incredible things about the public health system, or about the health system in Cuba, is that public health is sort of woven into everything that they do. All the doctors, nurses, all health providers learn about public health and practice it. So one amazing thing that they do is that they map everything. So this polyclinic, the area that you see in the map is actually the area of the polyclinic. So it's not the physical building, but it's that building and everywhere in the map. And so in that catchment area is where all the patients come from. And just to give you an idea of that population there, it's about 25 or 26,000 people. And let me see some of the data here. 17.9% are 14 years or less, and they collect a lot of data, And it's really incredible that they use this data to implement the work that they do at a clinical level. So they have this treatment, this sort of paradigm of treatment with these four: health promotion, prevention, treatment, and rehabilitation. And so they use that to plan up to 1 year ahead. And they plan like the minimum treatments. So for a mother who's expecting, there'll be a minimum of 16 prenatal visits, and so they use this data to plan their care for the whole year. And so the people in phase 3, which would be the treatment, or 4, which is the rehabilitation, would get more visits, and people in the health promotion phase would get less. And so they use, and then on this side, we have the specialties. And so it's focused, their health system is largely focused on primary care, and all these specialties are part of the teams, which are headed by the family doctor and nurse. So the principles of the Sistema Nacional de Salud, SNS, it's based on both rural and urban health, which is what they write here. It's based on, it's not based on your political affiliation or any sex or race. It's not based on religion. It's just whether you're a Cuban citizen or not. And they also work towards the treatment and care of the international community as well, and that's embedded in their health system. And there's, of course, in the presentation that we went to at the polyclinic, there's Mr. Fidel Castro and a quote from him. He's all over the place. So the structure of the national health system is, as I've said before, it's a little bit complicated, but what was really amazing about it is that this base, sort of the bedrock of that system, is the primary care, and that's all these. And the red box is the polyclinic system. So the area de salud is the polyclinic catchment area, and the grupo básico is that team of primary care and specialists. So they'll have a dentist, and so this is the sort of outlining the group. And so it's a dentist, a pediatrician, gynecology, internal medicine. And so they have that team of specialists, which is sort of up here, and they're working with a couple of the primary care teams. And so, and all of these data and all of this information is collected at a national level and managed at this kind of higher level and very structured. More of the values of this health system are focusing on the social determinants. And in my other PowerPoint, I had this picture on the left right side of a software that they're starting to use now that tracks the social determinants of health of patients within the polyclinic area. And when they've only been doing this for a few years, I think they started it in 2016, but I was really excited about that. And some of the things that they found out were that patients weren't getting access to transportation. And on this slide, I also had a picture of an electric bus. It's vanished, but they have some, in Havana, they have like all electric buses as well. So they're trying to work with those data and bring more transportation towards hospitals and clinics, and really taking into account social determinants, which you all probably know better than me, whether that's incorporated in the health system here or not. But I was really impressed by how much they consider that, and that they're analyzing those data at the level of the polyclinic, and even at a national level. So again, another huge achievement and amazing program that they have is for maternal and child health. And they've achieved 0 infant mortality and 0 maternal mortality. As you can see here, that's not the case in the United States. But we can see that one of the establishments that helps them with that achievement is this kind of place, which is called Hogar Materno-Infantil, and it's for expecting mothers to go and live if they're living in a difficult situation, like a situation of domestic violence or poverty or anything difficult during their pregnancy. They can go stay there. There's health providers who will take care of them and sort of monitor how they're doing. Once they go and give birth, they can't stay there anymore, but that kind of a place is a residential place where they can stay and receive care. And it's, of course, all of this is funded by the federal level. So other strategies that they've done and things that they've tried here are a new treatment for diabetes, and they're reducing the level of amputations by sort of taking a more preventive approach. And because as you can imagine, when the government is paying for all the health care, it's very expensive to do extra surgeries and extra procedures that don't need to be done or that can be prevented. So at the level both of quality of life for the patient, but also for major cost saving, they're doing a lot of innovative research for prevention. And they also are 100% covered by vaccines, and they have a number of infectious diseases that they're still dealing with, such as tuberculosis, viral hepatitis, meningitis, and leptospirosis, which are pretty well covered by the prevention programs that they have. As far as women representation in policy making, Cuba is among 3 countries with 50% representation in parliament, and it's one of the highest percentages of women in parliament in the world. And so there's a map of Cuba. It kind of looks like as they said, a lizard. And so the next day, the 3rd day of the trip, we went to a women's cooperative. So we met a woman named Eloise, and she started this beautiful farming collective. She was a teacher, and because of that machismo culture that we touched on in the beginning, she pitched this idea to her husband about starting a farm to address some of the food security in a more rural area in Artemisia province. And he said, no, like, how will you do the housework if you're doing a farm? And she was like, okay, well, I'd rather do the farm. And I think it was really difficult because she and the other women who were presenting about starting this farming cooperative were both really pained by that relationship and that circumstance, but they were also had a lot of conviction to do this to increase food security in that area and grow medicinal plants. And so they have this beautiful farm. And so here are some of the pictures of the farm. That's cashew, the pink fruit over there, and hanging down from there is the cashew nut. And this was the restroom at the farm. This is an orchid. They have beautiful orchids at the farm. And so she and her son actually worked very hard and started this farm, and now they have other workers. But it was really a huge endeavor, and the other women who presented with her started a cultural center, and they're sort of reviving the culture of runaway slaves and bringing back that food and the traditions of runaway slaves. And they gave us some coconut bread to try, and it was unbelievable. It was really good. And so we got to see how women sort of fight some of these societal barriers, but still have that conviction to do it. And it was pretty amazing. We also saw some of the process of making coffee, and they took us on a tour. MEDICC organized a tour of the place where it was done traditionally, where they dry the coffee, and the barracones is where the slave barracks were. And so it's actually beyond that wall, so you can't see it very well. And so all those, and the one on the side is where they put coffee beans all around here, and this huge wheel presses the coffee and crushes it, and de-shells it. The fourth day, we went to the Center for Molecular Immunology, and this is a very high-tech place. It's very amazing. They had a floor plan that I thought was really beautiful, so I took that picture. And so this is head by women, and many of the students are women. And their main projects that they're doing is cancer research and antibody production, and whatever kind of medical products that they make there, they're selling them to generate revenue. So this CIM is actually, most of the establishments that we've looked at so far are government owned, but in the last 10 years they've opened up the economy to self-employment. So this institute is half enterprise and half government owned, and they generate revenue with some of the products, biomedical products that they make. But anyway, I can talk about this one. It was a center for activism and women's rights. So this is, the woman that you see there is a psychologist, and she has a number of social projects, because there isn't actually, even though there's a lot of federal programs, there is not an official program for domestic violence and protecting women in that sense. So this is a center that does a lot of social communication and culture change work, and they're a very amazing organization, and they make all kind of networks with youth and with men and with sort of cultural change elements. And so that was really eye-opening to see the kind of banners and campaigns that they put everywhere. They put them on buses. They worked with Oxfam and made a movie, because one of the things that I even experienced in Cuba was there was a lot of like very forward men who just come forward, and which is part of the machismo culture, and they just say, hey, like catcalling kind of thing. We also definitely have that here. And so one thing that they did, that organization, was make a video where it was actually kind of funny, where women were doing the catcalling just as a social experiment. And the men came and said, oh, that's so strange, like, to see women acting like that. I feel sorry for them, like, why are they doing that? And it was just kind of interesting to see that social experiment and other kind of social experiments that that organization does. So that was really eye-opening. One of the really incredible things that we got to do was we got to talk to a lot of health providers. So our last day of the trip, day 5, was talking to women who are doctors, nurses, IT professionals, speech pathologists, statisticians who have gone abroad and helped out with, just done their own job but done it abroad. And and they see this as a duty. So if you remember from one of the earlier slides, part of the national health system included international work, so they see it as a part of their own job. So we got to talk to them and ask them questions, and they said that even many of them have families, they have children, they have parents, and they go because they feel that this is a duty. And I was really touched by that. And I had a lot of numbers on the presentation about how many providers are in different countries, but the people who we spoke to had been to Mozambique, Venezuela, Guatemala, Zimbabwe, all kinds of places, and it was very amazing to hear their stories, because very often Cuban doctors and health professionals go to the places where local health professionals will not go. And they told us all about that, and one physician told a story about how she was working with a nurse, and I don't remember which country it was in, but it was a rural area, and it was a place where the part of the custom there is to have a lot of children, maybe like 9 children on average. So that was normal. So the woman that that was telling us about this was a primary care physician, but she had a crash course in surgery before she went to Africa, and she was working with a nurse, and she had to do a cesarean section on the woman who was pregnant, and due to a complication, which maybe David would know what that is, they had to take out the uterus of the mother, and she was bleeding so much that the doctor and the nurse they just got the gynecologist on the phone, and they were like taking the consultation and doing this procedure just via phone instructions. And then they actually ended up giving their own blood because they had no blood supply and no other basic supplies there. So they've gone through a lot of very difficult circumstances to do this work, but they keep going because they see it as part of their work, which is, I thought that was an amazing ethic that they have, and sort of perspective on the global healthcare. So, and there were all kinds of amazing stories. That was just one of them. And so these were some of the people. And so part of the reason that they go, though, is that their national health system, takes care of them to do that. So that was one of the incredible things that they told us about, was that that the Ministry of Public Health takes care of them, makes sure they get to vacation, make sure they come home and see their family, and provides that as if they're just doing a job, because they don't really go as an organization very often. If us as health providers or as American professionals go, we'll go with an organization like Doctors Without Borders or Save the Children, or we'll go with someone, but what Cuban health professionals do is that they slide into the health system of that country or place that they're going, and they do their work as part of the health system of the place, which is also unique. So we also, on the same day, we got to hear stories from the students of ELAM, which is the Latin American Medical School. Again, I'm not sure if I mentioned it already, but it's only for international students, paid for by the Cuban government. And it's a really amazing place where people from all over the world, so there were students from Angola, from Colombia, from Los Angeles. There's one student who had gone to Evergreen State College and then came to ELAM. So I was excited to meet her. And the one wearing the pink came from Chad. So they came from all over the world, and so what they do in ELAM is they start to learn Spanish when they come, and then they start taking the medical classes, and then when they begin their clinical education, they integrate with the Cuban medical students. And so it's a really incredible place where people from all over the world who never would have had an opportunity are able to come. And one of the videos that I wanted to play for you was one of these students, I don't think she's in this picture, the one from Angola. She had been treated by Cuban doctors as a kid. So when she grew up, she said, oh, I would like to go to Cuba for medical school because those doctors were amazing. So that was her story of how she got there. So it was wonderful to hear about that and the opportunities that Cuba provides locally when they go to other countries and fill the voids in healthcare, but also what they provide in terms of making other countries, poor countries, more like fortifying the health system in that way as well, by helping them get health professionals. Because one of the stories that they were saying were that they wanted to go to medical school in their own country, but sometimes the professors wouldn't show up. They wouldn't have class for 2 months, and they couldn't really get an education in that way. It was very difficult. So going to Cuba meant a real opportunity. So I just put these on here. These are some paintings, and this is a kind of landscape. There's mountains. So I will open it up for questions now.
What experience did the patients have?
Well, that's actually a good question. We didn't get to talk to patients in the clinics and in the hospitals, but myself and some of the people on the trip were able to go just walk around Cuba and meet people and talk to taxi drivers and most of the people were pretty pleased with their healthcare and satisfied with it and grateful for free healthcare and free education. And I can't think of any complaints right now, but I'll keep thinking about that.
Had any of them lived in a different country with a different system that they could compare to?
The students that we spoke to mostly were all from other countries. So the people from those countries were definitely, even the ones from America, because there was a student from New Jersey, from Los Angeles, from Maryland, and I think the comparisons that I was able to hear about were favorable towards the Cuban health system, especially in terms of being able to go when you need care, like not being afraid to walk in because you'll be worried about how much it'll cost.
So, here in the United States, there's a lot of discrepancy in the remuneration of salaries of physicians. The primary care people make much less than, for example, the interventional radiologist and cardiologist. Did you manage to get some information on what typical discrepancies might exist between specialties, or are they pretty much homogeneous in terms of their payment? Yeah.
So what the doctors earn there is about 60 CUC per month. So that's very little. And the compensation for everybody is very little. The people who actually make the most money are people like taxi drivers and people who get tips and people who work with tourists. because they get tips in dollars, and they get a lot of extra supplemental income. And people who are doctors and nurses and professions that are highly paid here do it for the personal and professional satisfaction of it. And so the director of the polyclinic who gave us the talk about the whole health system, she was saying that she lives comfortably because her husband is a cook.
Mentioned that they developed a new treatment for diabetes, or they were developing one.
They're trying it. They had a lot of innovations that I didn't even put on this slideshow. They had a treatment, a 6 to 8 week topical treatment for diabetes, for ulcers, for foot ulcers. They were telling us about a vaccine for lung cancer, not to prevent lung cancer, but to prevent symptoms in 3rd and 4th stage, to improve breathing and improve quality of life. They were telling us about a nasal spray that they're developing to alleviate or sort of work on the progression of Alzheimer's and Parkinson's. And so that's a new thing that they're developing many interesting things that are definitely for patients' quality of life, but I can see it as a huge cost saver as well, because so many of these diseases are very expensive when they progress.
Do they make their insulin, or do they within Cuba, or do they import it from someplace? You've probably heard what's been happening to insulin prices here.
Yes. That is a good question. I think we did cover that, and I don't remember. I can try to find that out and send it to David. Yes?
This has to do with you in the mother and infant, the home that they can go to, especially if the conditions for maternal health and child health are not good conditions. Then what happens after birth? You said they have to leave that facility. Where do they then go to? Back to their squalid living?
They do go back home, and we didn't get to learn as much about next steps of that program, but I don't know if it was evident with all of the diagrams, the pictures of the slides that I showed, but in each of those primary care teams, there's also a social worker. So that might be part of the safety net of dealing with people who have difficult circumstances.
You mentioned that they cover all citizens. Now, do you have any refugees there? Or, for example, if I were a tourist and I went and got sick, would they take care of me? Was there a charge?
As far as I know, yes. Because we were told when we were going with MEDICC that we didn't need to get insurance to go there or anything like that. So as far as I know, I think it's covered.
So you had mentioned that some of the research was partly individually run, or I guess I wouldn't say privatized, but did you run into any other facets of the health system that are moving towards a privatized healthcare system? So like for extra care, for example. So we know that in Brazil, plastic surgery is actually part of the government program as part of this single payer system. But in Cuba, did you see anything that was like more privatized, or?
Oh, that's a good question. Well, I mean, so the privatization is happening, but it's going very slowly, and it's called self-employment. And what I saw of that is that it was CIM was 50%, so that was the most privatized thing that we got to know about.
Yeah.
In terms of extra procedures, I don't know that there's enough resources to do anything extra. because we were bringing medical supplies. And I know that most medical establishments, especially with the crisis in Venezuela and during the special period in the 1990s, when resources were really low, and there's still not a lot of surplus of resources. I don't know how much, but that's a really good question. What is the protocol for extra?
At first, people could travel to the US and to Cuba better at the end of Obama's term. And then when Trump took over, he changed that in some way, and I was wondering if you knew how is travel out of Cuba and to Cuba handled now in the US?
The way that we were able to go was through a people-to-people exchange, and I believe that's what was repealed while we were there. So we were lucky enough to be there, but before they stopped it, because had they done it a few days earlier, we would never have made it to Cuba. But some of the ways of exchange still do exist. I believe academic exchange still exists. And certain, maybe one other visa you can get, but I think he's tried to eliminate most of the other ways you can travel there. Well, there was a policy of immigration for Cubans that once you reach the shore, you're safe. I don't know if you know about that.
Yeah, that's the old way.
That's the old way.
Vote and hope.
So they stopped that, and then I think that the current tightening of immigration that's happening also applies to Cuba in the same way. But I'm not the expert on that. So these are some of the public health kind of advertisements or propaganda, as they call it, that are present in the clinics, in the doctor, nurse, in the buildings. So one thing that I didn't get to show you is, I didn't get to show you this slide because it was missing, but this slide talks about some of the demographic issues that are current in Cuba right now. There is a housing crisis. Migration out of Cuba is a big thing. There's lack of both hardware and even things like machines and washing machines and car parts and that kind of thing, but there's also a shortage of technology, and people said that was a limitation. There's a big, a large percentage of the population that believes in Afro-Cuban spirituality and religion. And the professor who spoke to us said that she actually opened her talk by saying that she thanks the African diaspora for the open society that they have, which was really impressive to me because I've never heard someone in the US thanking our African diaspora for the great things in our culture. But she was saying that there's no opposition to abortion and vaccination and some of the things that we're struggling with here because of that culture. And she also wrote that they're very pragmatic, and so gender roles are a little bit more flexible because of that influence on the society. And she also talked about how they have more of a culture of serial monogamy rather than marriage. And part of the empowerment that started with the revolution in 1959 was the women's empowerment. And I have it on one of these slides, but one of the laws that came into effect was equal work, equal pay between men and women, which we don't have here. And and things like that, which gave women a lot of power. And actually, someone had asked a question, did you ever get to talk to patients? So when we talked to people on the street I actually had a lot of fun asking like different men that we met about machismo. So I would ask them, like, do you think it's more in the United States or in Cuba? And they were like, definitely United States. Cuban women have all the power. So I thought that was interesting that they feel that way, even if there's more progress to be made. Another interesting thing is they're on the 8th, oh, this covered it up, but they're on the 8th version of their constitution. So they keep changing, they keep amending. And I thought that was very amazing that they do that. Let me find some of the other pictures. Another thing that one of the things I was most impressed by is that they keep record of epidemiologic surveys during the medical visits. So when the doctors and nurses see the patients, they also have an epidemiologic survey that they fill out during that visit. And as someone, I taught an epidemiology course this quarter, and all of my students are health providers. They're all respiratory therapists and paramedics, and they all have experience with patients, and none of them had heard of epidemiology beyond maybe the word, but they didn't know what it was about. So it was amazing to me that this is very integrated into their health system. This is the software that I was really excited about, that they use at the level of the polyclinic to measure social determinants of health, and that's the electric bus. And what else did we miss here? Oh, so this slide was completely missing. This one was the family nurse doctor team. And so this is an apartment building where people live. And so the doctor, this the nurse, and they live in that building. And it's a little stressful because they're on call while they're there. But they definitely do get days off and everything. But they have medical charts both for the patients, but also at the level of the family. So that's another way that they can assess risk of patients, is by having a chart for the whole family. More pictures. Oh, this is the Capitol that I was raving about earlier. It's a beautiful building. This was when we went to Parliament, and this woman is from the Parliament, and these other two are from the Cuban Federation of Women. And that's a big volunteer-based organization that does a lot of the community health work with rural populations and stuff like that. So they do anti-vector programs and screening and education. And so this volunteer organization, the Cuban Federation of Women, does much of that work. And so these are some of the pictures that we're missing. And I think I'll leave it up to questions again, because I think we're almost time's up.
Yeah, we've got some more time.
Just quickly,
It's my turn.
okay, with preventive medicine, have they managed, unlike just about everywhere else, to deal with this obesity epidemic? Is there data on that? Because they have diabetes.
Well, that's actually a great question. What I saw in some of the data that they were presenting is that undernutrition is much more of a problem.
More under, I see.
So diabetes is probably maybe alcohol related.
Oh, that's significant. And mental health generally, any data on prevalence and
Well,
management? Anything innovative in dealing with mental health?
One thing that's amazing is that most of the providers are trained in some type of natural medicine and stuff like that. So they use, I think there's a lot of, because of the African diaspora culture, there's a lot of mental health that's not called mental health, which is ceremony, and they regularly people talk about taking out the bad energy and bad spirits, and so I think in non-Western terms, there's a lot of cultural work around mental health. I didn't see a lot about it in the health system, but what I did, someone asked a question about the opioid epidemic and asked if it's present in Cuba as well, since it's so big here. And one of the professors was telling us that there's no way to get opioids in Cuba. Like there's not very many there. But what happens is when the packets are sent from South America to North America, sometimes they send them by sea, and they actually wash up on the Cuban shore. So, and these are huge packets. So people who get a hold of those they might sell them and use them and things like that. So they've been seeing more of that because of the sort of by way of sea. But in terms of actual mental health and psychiatry, I didn't hear a lot in this trip.
How about homelessness?
Yes, there is a housing crisis, which one of the professors mentioned, but there's also intergenerational family living. So it's very normal for people to live with grandparents, children, this, that. So housing is a problem, but there's more mechanism of dealing with that because of the culture. But there is homelessness.
When I was there were clinics for natural medicine, just focusing on natural medicine, kind of standalone. Do they still have that sort of thing?
We didn't get to see it, but I believe there are, because when we were at the farming cooperative, there was, they were growing all natural medicines and they were supplying it to medical providers, but there must definitely be.
You actually saw I saw pharmacies. There were there were pharmacies that dealt with natural stuff. They didn't have no medicine. Exactly. But there were no clinics that I saw. But the doctors would prescribe these natural medicines from the natural pharmacy as well.
Well, I saw one who was basically focused on all natural remedies.
Okay.
And there was some training in schools along that line. One thing that impressed me most of all when I was there was in a small community clinic. You mentioned they have the records of the family all together, and the people, the providers in those clinics know the family and know each person within that family. And if somebody doesn't show up for an appointment, they will send a nurse out to go see whether there's a problem with transportation, was the patient too sick to come to the clinic, whatever the reason was it they were just not being a good member of society by filling their obligation to come to the clinic and their appointment that they made. So, did you see any evidence of that?
Yes. There was definitely sort of the care that they got at the clinic, but as shown on that slide with the map, the polyclinic is the whole area, including the housing and the residential area and everything, and that's the polyclinic area. So they don't count it as the physical building, but as those people's homes. They'll go there, they'll find the patient. So they told us all about that, and I was also really impressed by that. And so Brazil is in a crisis right now because Cuban doctors were serving, I guess, more than 28 million people, and the current administration there had a problem with Cuba and a diplomatic issue and kicked them out. So 2,000 of them actually tried to stay. The article I read is in the Miami Herald. So 2,000 Cuban doctors and health professionals tried to stay in Brazil, but they're having a really hard time, like all over the world. In the 2013 to 2015 Ebola epidemic,
Yes.
Cuban doctors were on the front line, and health professionals. What it says in this article, which is a few years old, 5 years old, is that there's 50,000 health professionals around 66 countries. If you want extra reading to do about this and you like this topic, MEDICC Review is a really good paper, and they collaborate with all kind of institutions and things like that, and people like David, or people who go on the MEDICC trips also contribute to the MEDICC Review. So it's a really great source of news about medical system in Cuba and issues. And I can also keep my card, and I can send you some of the articles that MEDICC shared with us if you're interested. So I'll put my card on the table, and
Thank you.
Thank you for having me. Is there any other questions? Yes.
I wanted to ask, I know that some of the people that are seeking office in 2020 are advocating for free education to a certain level, and others are advocating for a universal healthcare system. I'd like to know what your thoughts are on that, given your recent experience in Cuba. Did it change your attitude about it?
That's I love this question, because something that I learned in Cuba was that the patients, like they were talking about 100% vaccination rate and sort of the high level of use of the healthcare system. And part of that is that it's free, but part of that is the high literacy rate and the fact that that most people have at least middle school to high school education. So almost everyone can read. So that being said, that was part of the utilization of the health system. So I think now I'm starting to see that they're very linked. So if we have one without the other, like it might be impossible. Like if we have a national healthcare system, but we still have people who don't know how to utilize it, and the health literacy is less, maybe it wouldn't work as well as it does in Cuba. So I think that's great, because I'm starting to see how linked those two are after being in Cuba.
Thank you.
Okay, thanks so much.